A journey of discovery, the value of interprofessional practice in a healthcare setting. According to Queensland Health, interprofessional practice, or IPP, involves health workers from different professional backgrounds working together with patients, families, carers, communities, and each other to deliver healthcare. Come along on a journey as 6 occupational therapy students, through interviewing various health professionals, explore the role of IPP in holistic care. Using 3 fictitious case studies, these students demonstrate how our characters, Tom, Shirley, and Leslie, may engage across the care continuum in an IPP model to meet their individual needs. The first case the students looked at centres around Tom. Tom is a male aged 7. The referral has been made by Mum with concerns that Tom's sensory preferences have become more pronounced and that he has difficulty engaging with his peers in social settings. It has been reported that he enjoys talking about Star Wars, however struggles to maintain conversations within other topic areas. Mum has reported that he is starting to act out in class to avoid tasks when they become hard, and that his teacher has recommended a cognitive assessment. He has recently begun biting himself and kicking holes in walls. The students conducted interviews with an occupational therapist, a general practitioner, a psychologist, a behaviour support practitioner, as well as an assistant principal at a specialist school to understand how they may work with Tom and his family. Here is what they discovered. Miff, the occupational therapist, outlined that she would work closely with Tom, his family, carers, and a range of other health professionals to meet his needs. She would use a range of approaches and tools to provide assessment and intervention of Tom's daily function, focused on enabling him to meaningfully engage in activities within his specific context. Miff noted that occupational therapists are trained to have a wide lens, to think systematically, and have a holistic approach to care. She also recognised that when working with other health professionals, having strong interprofessional relationships and frequent communication enables a holistic and effective approach to the child's care. Steve is a general practitioner, and he identifies his role in working with Tom is focused on ensuring that his physical and psychological health needs are met, and also taking into consideration Tom's engagement with services and society on a broader level. Steve recognises the value of interprofessional collaboration and being able to rely on specialised support to meet the needs of specific clients. Glennis is a behaviour support practitioner. Glennis would work closely with Tom and his family across a range of environments to understand functions behind Tom's behaviour and look at ways to improve Tom's quality of life. She finds that working in a team with a range of other professionals is critical in ensuring holistic client care is provided, and that interaction between disciplines is a key ingredient to success within her role. Lisa is a psychologist. She specialises in working in children and adolescent mental health. Her role would include providing individualised assessment, contributing to process of a diagnosis, as well as delivering focused therapy and counselling. Lisa identifies that working interprofessionally would enable improved outcomes for Tom. Through collaborating with other health professionals across different stages of the care continuum, including assessment, diagnosis, and intervention, Lisa feels she can develop a comprehensive understanding of what is happening for a client and is able to best meet their needs. Alicia is an assistant principal at a specialist school that works with students with a variety of support needs. In working with Tom, Alicia outlined that she would work closely with Tom and his family within the school context, and that where possible, they would integrate interprofessional practice with the school curriculum framework. Alicia identified that they would collaborate with a wide range of other professionals that may include an occupational therapist, speech pathologist, physiotherapist, and social workers, just to name a few. She notes that having a good understanding of other professions' roles and working together to complement each other is important in being able to best meet the needs of the child. The next case study that the students focused on was Shirley, who is 72 years of age. She had a stroke 18 months ago. She is living alone at home. Her declined mobility has resulted in her relying on paid care staff to do her shopping, personal care, and housework. Shirley reported that she gets frustrated that she can't think of the words that she wants to say. She now avoids social situations and going out in the community. She also has concerns that her son is accessing her bank accounts without her permission. The students conducted interviews with an occupational therapist, physiotherapist, a speech pathologist, an exercise physiologist, and a social worker to understand how they may work with Shirley. Here is what they discovered. Jess, the occupational therapist, outlined that her involvement in working with Shirley would involve functional assessment and intervention related to her activities of daily living and, if relevant, assessment and modification of the home environment. She notes that therapy would depend on Shirley's goals, motivation, her available supports, and what matters most to her. Jess describes having had positive experiences of IPP in her role as an occupational therapist and recognised the value of it in contributing to positive health outcomes for clients, particularly if communication is prioritised. Lauren is a physiotherapist. She has a special interest in working with neurorehabilitation and has experience in working with clients who have had a stroke. Working with Shirley, Lauren would focus on assessment and intervention of functional mobility in the home and in the community. She identifies that with Shirley, she would work alongside occupational therapists, exercise physiologists, speech pathologists, social workers, allied health assistants, psychologists, medical staff, as well as Shirley's family. Lauren has found joint sessions with other allied health professionals can be beneficial in some circumstances, as is being open to learning from each other within the team, and as looking to each other for support as required. She further noted it can be difficult to manage complex client presentations if there is not an interprofessional context. Rebecca is a speech pathologist. Rebecca said that she may work with Shirley to explore why she was experiencing difficulty saying the words that she wanted to. This may include a range of assessment procedures, including observing Shirley communicate in everyday settings. If intervention was deemed necessary and appropriate for Shirley to assist her communication, speech pathology intervention may include individual therapy and/or education and training for her communication partners, supporting the notion that communication is a basic human right. Regarding interprofessional practice, Rebecca notes that IPP is central to providing holistic care, and it is therefore very important to workshop any barriers that may arise in interprofessional practice. Social work may become involved with Shirley, especially in regards to her concerns that her son is accessing her bank accounts. Lisa is a social worker who has a particular interest in rural health and in working with marginalised consumers, including individuals who have had trouble accessing health services, people from lower socioeconomic backgrounds, individuals with disability, and First Nations people. She describes the role of social work in working with Shirley could include coordinating family meetings and support groups, communicating with other allied health professionals, and collaborating broadly to focus on client goals and outcomes. She identified that creating innovative solutions for complex problems goes to the heart of being a social worker. Tiana is an exercise physiologist who has a history of working in both private practice and community settings. In working with people who have experienced a stroke, Tiana utilises a range of subjective assessment as well as formal tests to establish focus areas for treatment. She notes that she would assist the client to not only regain movement and strength in the weakened side of the body, but also in the non-affected side to ensure they maintain available strength and movement. In her work, Tiana regularly works closely with physiotherapists, podiatrists, and dietitians. She explains that there is frequently cross-referral and a collaborative approach to care which ultimately benefits the client. Our final case study focuses on Leslie, who is 86 years old and has Alzheimer's dementia. She is living in an aged care facility with access to various allied health services. Her diagnosis has progressed to late stage 2, and there is a noted reduction in her ability to walk independently. She becomes very agitated at times and is drawn to wandering around the facility, going into other people's bedrooms uninvited. She loved music, dancing, doing craft work and gardening. Nursing staff describe her as being uncooperative at mealtimes and are concerned about her dietary intake. The students conducted interviews with an occupational therapist, speech pathologist, physiotherapist, dietitian, and podiatrist to understand how they may work with Leslie. Here is what they discovered. Charmaine is an occupational therapist who is passionate about the role of occupational therapy in working with dementia. Charmaine identifies the occupational therapy approach in working with dementia is personalised to the client, tailored to their specific needs, and would address activities of daily living, stage of dementia, challenges being faced, and individual client goals. In working with Leslie, Charmaine would consider physical activity in daily activities, social engagement, and assessing factors that may be contributing to her agitation. Charmaine notes that holistic care is really important. Clients benefit from interprofessional practice as well as the family members or the carers. They can see every aspect of their function is being seen to and addressed. Bree is a dietitian who has worked with dementia clients in rehabilitation and residential aged care settings. She notes that common reasons for referral to a dietitian with clients experiencing dementia may include unintentional weight loss, pressure injuries, or prescription of texture modifications by a speech pathologist. A dietitian's input in dementia care can include a range of strategies and approaches throughout the course of their care, with a particular focus on advanced planning for late stage of dementia. In working with Leslie, Bree's intervention may include consideration of contrasting foods, finger foods, preferences, supplements, mealtime engagement, and enteral feeding if oral intake is insufficient, with a constant focus on communication with family, carers, and staff. Bree works closely with a range of other professionals in dementia care, including speech pathologists, occupational therapists, nurses, medical staff, food services staff, continence, and stoma therapists. She recognises IPP helps us stay with the patient's goals at the forefront. Although goals may be slightly different for each profession, they overlap. They intertwine in some way. She also recognised common barriers to interprofessional practice can include communication challenges and establishing rapport. Brian is a physiotherapist who is passionate about the care of those aged 65 years and over, including those with a dementia diagnosis. Brian takes a person-centred approach to client care and likes to involve family members and carers where possible. In working with Leslie, Brian would assess physical function through a combination of observation and subjective experience and formal assessment where appropriate. Intervention would focus on mobility in Leslie's natural environments with consideration of challenges as well as strengths. In working in aged care, Ryan finds you can make a really positive impact on people's life by giving them a sense of ability and purpose. He recognises a team approach to care is beneficial, with a range of health professionals contributing to an environment where different sets of eyes, experiences, and ideas can create a better outcome for the client. Rebecca is a speech pathologist with experience working in a range of different inpatient and community-based settings. She identifies that a speech pathologist may work with Leslie to explore if there are any underlying chewing or swallowing difficulties in the mealtime context. Communication may also be another intervention area. Rebecca would work with a range of health professionals and staff relevant within Leslie's residential setting that could include occupational therapists, physiotherapists, nursing staff, dietitians, medical staff, and food service staff. Rebecca acknowledges that communication between health professionals is essential to improve client outcomes and that we need to respect and invest in time for practitioners to communicate. Until this is a priority and advocated for, IPP will be hindered. Brent is a podiatrist. He describes his role in working with this client group as providing basic hygiene practices such as nail care, wound care, maintaining high-pressure areas, and communicating with family and carers of the client to enhance care. Brent perceives there are multiple benefits to working within team environments and notes that in aged care settings such as Leslie's, He would usually work closely with a range of other health professionals such as general practitioners, physiotherapists, dietitians and nurses. He finds that communication in interprofessional practice is vital, whether it is more formal or structured team communication or on a more casual ad hoc basis. But he also recognises that IPP communication can be challenging and requires an integrated approach that is considered and negotiated. To wrap it up, the students gained many valuable insights throughout the course of these interviews. They had the opportunity to reflect on the broad range of contributions that different professions make towards client care, as well as the critical role of interprofessional practice in delivering quality healthcare. It was recognised that IPP plays a valuable role in delivering holistic care, meeting client goals, and in managing complex client presentations. Despite the accepted benefits of IPP, it was also acknowledged within the interviews that interprofessional practice can present challenges, such as resource constraints, lack of shared understanding of different professional roles, and ineffective communication. It is evident that a thorough and considered approach to IPP is required to effectively address practical barriers and enable interprofessional practice to impact quality holistic care. We would like to acknowledge that this video was a collaboration between Going Rural Health, an initiative funded and supported by the Commonwealth Government Department of Health in Canberra through the Rural Health Multidisciplinary Training Program, and Charles Sturt University OT faculty, including both staff and students, and of course, our interviewees. We would like to make special mention to the students who made this project happen: Harry Matthews, Zoe Lees, Kristen Pinney, Taylor Lee, Tegan Keesing, and Kayla Watson. Thank you, and we look forward to you joining us on a Going Rural Health placement in the future.